A lot of patients come to us with their surgery already done somewhere else, and they come and ask me, sir, मेरी surgery ठीक हुई है क्या? So in this video, I'm going to share 3 very important points which can tell you that some tissue damage had happened in the last surgery which has not healed. Hello friends, I'm Dr. Pankaj Velicha and I'm a hip and knee replacement surgeon in New Delhi, India. In last 20 years, I've operated more than 3,700 patients of hip and knee and have helped them in getting back to their normal lives. Point number 1. In a hip replacement surgery, if you have a foot drop, then probably it was a sciatic nerve palsy, which means that your foot is not moving up and down. Then it means your sciatic nerve has been injured or has been stretched during the surgery. Generally, sciatic nerve palsy is mild after hip replacement surgery. It is not very common, but there is a subset of patients who can experience foot drop after a hip replacement surgery, and most of them are due to nerve stretching. That is called neuropraxia, and which recovers in due course of time. But a very few patients where the surgical handling was such that by one reason or the other the nerve has been cut, then it doesn't recover until and unless we do the repair of the nerve and then allow it to recover in due course of time. 2, that you have been told to delay weight bearing, or your post-operative surgical protocol is slower than what was discussed before the surgery, which can happen either due to a fracture in the femur, which could be a crack which just needs wiring, or which could be a proper fracture which may require a long plate fixation, or a fracture in the acetabulum which can be handled without any fixation, or a screw fixation, or a plate fixation depending upon the type of fracture. So when we are preparing for the stem, a lot of people ask me about the approach, anterior approach or posterior approach. So literature tells us that in direct anterior approach, the chances of fracture of the femur are relatively high as compared to posterior approach, although it is not very high, and as the surgeons are gaining experience in doing direct anterior, this incidence is also coming down, but still in literature it is relatively higher than the posterior approach. Generally, we allow hip replacement patients to put full weight from the next day, that is within 24 hours of the surgery, if their bone quality was good and if it was a primary hip replacement surgery. But if you have had sustained a fracture during the surgery because of any reason, then the weight bearing protocol is delayed and patients are kept non-weight bearing or toe touch weight bearing for first 4 to 6 weeks till the time we are confident that the fracture has started healing. And 3, if you are experiencing some serous discharge or discharge which is like watery mixed with some blood or clear discharge, then probably it is the tissue damage under the skin, subcutaneous fat, or in the tissues around the muscle, and it is kind of showing some delayed response to healing. Now, it generally happens if there is a lot of tissue inflammation inside because of overstretching of tissues, or in patients who have excess fat around their hip area. The thicker the fat, the more are the chances of lipolysis or fat necrosis, and which can also come out as a serous discharge. So generally, if that is happening, it typically tells us that the fat or the tissues inside have been overstretched during the course of surgery, and which can happen in obese patients, and the tissue healing can also be slow in diabetic patients, because diabetic patients you would all know that the tissue healing is slow. So if your wound is throwing discharge, which could be a thin serous fluid or mixed with blood, then it means that the local tissues under the skin, the fat under the skin or muscles have not really responded well to the surgical intervention, and they may take time to heal. So these are the 3 important points by which you can actually understand that there has been some tissue damage during my surgery. So I hope you understood what I mean by local tissue damage and you found some value in this video. To know more about hip replacement surgery and other commonly asked questions around this hip surgery or hip arthritis, you can subscribe to my channel, or you can also follow me on Instagram at Dr. Pankaj Velicha Official. I'll see you in the next video now.